Good afternoon, everybody. This is Dr. Bryce Eagar from Gateway Oral Health Center. I have a lecture about chronic sinusitis that can come from the mouth. And the mouth is not one of the areas that we would typically start to look at, but from being a dentist, it's the first place that I start to look at. I want to thank Fusion Pharmacy for putting this together and trying to coordinate all the providers. That can be a difficult job sometimes. So here's a little bit of my background. I started it down in Las Vegas with my education and went to dental school in the University of Minnesota, and I am a general dentist. While there, I joined the Minnesota National Guard to help through dental school, and my first job was in Farmington, New Mexico. After practicing a couple years there, decided that St. George was the ideal place to live, and we moved there. And since then, I've become a major and continued in the Army Reserves. In my post-school education, I've earned a fellowship with the American Academy of Oral Systemic Health. I'm the founder of Gateway Oral Health Center. I'm the in-house dentist at the Southern Utah Veterans Home. And I'm a general dentist who practices biological dentistry, sleep dentistry, airway-focused orthodontics, cosmetics, and family dentistry. So sinusitis from a dentist perspective. And I take a look at it from a couple different areas. One is anatomy. Two is from biofilm and its progression and destruction. Then three, testing and imaging that can be helpful when trying to diagnose what is the source of the inflammation in the sinusitis. And I have some case examples to show. I put a big red warning here. Those case examples, I do have cone beam images, but then I also have one extracted tooth, and because I'm a dentist, I enjoy post extracted pictures of teeth for some reason. But this is not one of those pictures. This is a drawing of the profile of a face. And where we're going to start is right here in the middle. I have this little pointer up to kind of show. What I'm outlining here is the maxillary sinus. It's on the lateral side of the nose. And the first thing from my perspective is look how close these root tips are to the floor of the sinus. In fact, the roof of the mouth forms the base of the nose and also the base of the sinus. And so when things happen in the teeth and happen in the bone, and then it can cause inflammation in the sinus, as well as think about growth and development. So if someone's underdeveloped in their pre-maxilla, their upper front teeth here, let's go back, then they're not going to have as much opening in their nose. Same with the posterior teeth on the upper, the back here. If those are squeezed in, then we're not going to have a broad U-shaped sinus. And so anatomy-wise, these are important things. And hopefully some of my colleagues have discussed the importance of breathing in and out the nose. Now, here's a little guy, a patient of mine, and you can see, let's start looking up at this case right here. So this is someone who hasn't developed under his nose. His premaxilla here is deficient. These teeth should be on the outside here, and so he's a little bit underdeveloped here. And in terms of width, he's looking pretty wide, and that's been pretty good. He's been doing some work there, but still these front teeth were having an issue. And so one of the things that we're doing with him is pushing this area on his bone and then a little bit on the teeth so that we can move that bone out and develop this out this way so that those passages and septums and passages for the air are open so he can breathe. With this being underdeveloped, he has a tendency to get stuffy a lot and get all those passages clogged up, and then he reverts to mouth breathing. The other thing to look at is how high his palate is, and it used to be higher before the expansion of his teeth, and so as that palate drops down, that creates more space up in the nose. Next, the thing that we want to think about beyond anatomy is biofilm. Now, biofilm is where little microbes get attached to, let's say, the tongue, the teeth, the gums, and they start to grow and form these colonies. And then they grow and they create a kind of a slimy matrix between them. And then they start to diversify and having different species sharing resources, passing information between each other, evading the host, and then they will eventually break free and find another place to form a biofilm on. And biofilm, you can have good biofilm, you can have pathogens in the biofilm. And so this biofilm, it can grow on the teeth, here on the sides of the teeth or up on the top of the teeth. Now, if the biofilm contains acid-loving bacteria, what they will do is they produce acid. That acid will erode the enamel of the teeth. So on this diagram, the white is the enamel, the yellow is the dentin, and the pink is the nerve, which dentists sometimes refer to as the pulp. But if a biofilm has acid-loving bacteria, it will start to form decay on a tooth. And that decay will get from the beginning of the enamel through into the deeper of the enamel, right till it reaches that nerve or that pulp. And then when it reaches there, the bacteria can live in here and spread down these canals and come out and live down here in the bone. And when it does that, our body's defense system it wants to encapsulate it. So there's an abscess that's happened, but then the body tries to form a cyst around it to hold it in together. Now think about that when we go back to this picture. What if that happens on one of these back teeth back in this area? It travels down, it comes out, it lives in this bone. This bone is quite spongy, and so the bacteria can then come up into the sinus and live in this sinus. When they're here, they then have access to move up and into different locations. So that if that biofilm has acid-loving bacteria and decay is not taken care of, then we can get this situation going on here. There's another group of bacteria called anaerobic bacteria that like to live down in the gums, and they can evade down this way, and some of them can then just evade into the bone and move into the other spaces. Now here's a picture of a tooth that was extracted and sected, so we get a kind of a cross-section view here, and let's focus on this side over here. So right here, acid-loving bacteria made its way through the enamel. And then it made it to this area, which is the dentin. So the dentin is all this through here in the middle. The dentin is softer than the enamel. And so what happens is it balloons out. So it kind of worms its way through the enamel, then forms a balloon. Classic presentation of what a dental cavity looks like between there. Now what's interesting, the edge of the cavity is about right here. But then the bacteria is starting to live inside little tubes in the dentin called dental tubules, and they start to live and work their way down. Now here's where the nerve and the blood vessel and everything lives. And if the bacteria makes it down in here and there's an immune response, then they can make it down the roots and then form an abscess down there. Now, what I love about this tooth is the same process as over here, but this is not as far as long. This is what we call decalcification or incipient cavity or caries. And at this stage, the enamel hasn't broken down, just some minerals are lost and it shows that whiteness. At this stage is where we want to remineralize a tooth. All right, so one of the first tests that I find very important and very useful to run is an oral bacterial test. Now, I can show you this one because the patient name is Bryce Eagar. That's me. And I have access to hygienists every 3 months, and I'm a dentist, and I take very good care of my teeth. I floss all the time. I use the best products, and this is what my bacterial profile came back as. Each of these is a different species of bacteria, except for this one. This is a yeast which causes candidiasis. This is Candida albicans. This is strep mutans. So this is acid-loving bacteria, and I should circle this together because the yeast could jump in with that, and together they have a little party. Now, these over here are the anaerobic bacteria, and they produce toxins, and they can worm into spaces, and they can do damage to other places. So first thing, someone struggling with a chronic condition, I want to know what's the profile like so that we can start working on knocking these guys down and looking at them. The second test that I want is dental radiographs. Now, this one over here is a very traditional 2D dental radiograph called a periapical, and it's at an angle, so it shows us the crown of the tooth all the way up into the roots of those teeth. Here's that sinus. You can see the floor of the sinus right there, and so the sinus is right up there. Now, on this side over here, we have a 3D dental x-ray. This is called a cone beam CT scan. Now, a dental digital cone beam scan is much less radiation than a medical one. And so they're very safe, and they provide such a clear picture of this versus this, and they are so important. So here is a maxillary sinus, and you see a very thin cortical bone and then some spongy bone in between there. The roof of the mouth is the floor of the nose, and then the other sinus, and then on top of the bone there's a membrane called the Nadarian membrane, and it should have just a very thinness of gray. So this person's looking good. Everybody's nose is asymmetrical. Don't be surprised by that. So here's the sinus. We happen to be, this red line is what this box represents. And so there's the sinus, nice and open and clear. And then this blue line right here is what this picture is. And so here's one sinus and here's the other sinus. Now look at the roots of these teeth right here. Now imagine if something was going wrong in one of those roots, that's very intimate with the sinus. And sometimes that bone is just paper thin between the tip of the root, called the apex, and the sinus. So let's look at this individual. Now, this sinus, so this is the patient's right. We always refer to the patient's left and right. So on the screen, it looks like our left, but it's the patient's right. This sinus looks nice and clear. Uh-oh, what's going on over here? We have a thickening of that membrane, some inflammation, and then we've got all these like bubbles in there. Let's look at it. This one looks awesome down here. Whoa, that looks kind of different and strange. And then from this viewpoint, we can see that. Now, this person has sinus inflammation in there. And so what my job is to look at all the teeth to see, is there something going wrong with this tooth, this tooth, this tooth, this tooth? That could be the source of this inflammation. In this case, as I look through all of these teeth, I don't see anything coming from the mouth up into the sinus. And so this one, I would refer back to their doctor and say there's inflammation in the maxillary left sinus. The patient is actively trying to blow and get that gunk out of there, and they're introducing a bunch of bubbles in there. Now, remember this picture from this 2D picture from a couple slides ago? This is the same patient. So these fillings are these fillings right there. Look at the difference in information that we get to see here versus here. Now, to get this 2D image, what we do is we put a sensor in the mouth right here, and we have radiation come this way to that sensor. But what that does is that sensor, as it captures that information, it makes it all flat. So we can see height and we can see width, but we cannot see the depth that we can on an image like this 3D dental image. Okay, this next case is the one I've been warning about. There's a picture of an extracted root and a cyst coming up. So this individual, look at their sinus over here. So as I look down here, there is inflammation in the sinus. There's actually a space above the tip of the root, and we can see that inflammation coming off of there. And if we look from this one down here, you can see how that bone's been pushed back and that black space right there. So I could tell that in that black space right through there, that there's something that has grown and has pushed that paper thin bone away from the tooth, because it should just lay right across there like you've seen in the other pictures. And so this one had become infected. Oral bacteria made it into the tooth, lived in the root of the tooth, came out into the edge. And the body's reaction to that is to form a cyst. A cyst is your body trying to wall off that infection. But as that cyst grew, it hydraulically pushed that bone away from it. So after we extracted this tooth, this piece right there is that root right there. Now the tip of it should look just the same. So what this is right here is the cyst that is that black area on that radiograph. In this case, it was very lucky that that cyst came out as we extracted it, and then as we went in and cleaned up, there's very less cyst remaining. Now sometimes the cyst during surgery is attached to the bone and it's tight like a spider web, that we need to clean this infectious tissue out of there, scrape it, clean it, and then we bone graft it in there to let that bone heal up nicely afterwards. Okay, just a few more cases for tonight. This is a different scenario. This patient came to me and said, I had a tooth extracted about 2.5, 3 years ago. I just don't feel like it's healed. Now, from the radiograph, you could see it right away. Something black is in the bone there. Like it didn't heal. Like it tried to get some cortical or hard bone over the top, but it didn't fully form. Something's still going on inside of there. And you better believe that that's then leaking up into her sinus right above there. But the gum tissue had closed all the way. The gum tissue was pink, and it may have just a little pinhole that stuff could leak out of. But a lot of times these are asymptomatic because there's no buildup of pressure. It's just a chronic leaking. So we went in and cleaned all that out, ozoned it, and then put bone grafting in there, sutured her back up, and it's healing nice now. So these chronic abscesses, they can happen from infected teeth. They can happen from teeth that have had large fillings in the past, where the bacteria was already beyond the edge of the filling and into the nerve before the dentist started. Crowns with large buildups, and these are usually what we call the maxillary posterior teeth, the upper back teeth close to the sinus. Now, root canals can fail and they can abscess up into the sinus. Split teeth, or if there's a tooth that's broken off and the root's sitting there, and non-healing bone after surgery. And a common term for that is cavitation. And most of these are asymptomatic, meaning that pressure up in the sinus you can't feel. And so it can fill in half the sinus, quarter of the sinus, 3/4 of the sinus with inflammation, but you don't get like a swollen face from them. And so the best thing to do is these advanced images, as well as bacterial testing. So sinusitis from the dentist perspective. One is we looked at anatomy. So the shape of the mouth and the teeth shapes the floor of the nasal passages and sinuses. And if there is a narrowing, then we want to correct that. We may need to push on some bone. We may need to correct some muscle habits and swallowing and breathing habits to correct that anatomy, to open up those airways so that we can function through our nose. Next, we want to look at biofilm. What's in there? And what if there's bad guys, then let's work on inhibiting and getting rid of those. We do it with testing and imaging. I believe this takes a team approach. There's only so much things that I could do from a dentist for the sinus, and there's things that your functional medicine doctors um, can do to the sinus, but they can't take care of an abscess teeth. So I'm a firm believer in a team approach, and we typically get better results um, when we work together. Thank you so much, and hope you have a great rest of your evening.